Hello, everyone, and happy Monday. We are talking about neck and back pain while all of us are sitting all day, and this is such a pertinent topic that we are bringing today with Dr. Ahmad. Dr. Ahmad is a physiotherapist who runs a rehab center. So, welcome, Dr. Ahmad. You're on mute, Dr. Ahmad. Yes.
Yeah, thank you very much. I really appreciate you invited me on your show, and it was, very basic. Nowadays we are having these issues. So thanks for your interest in this topic. So definitely, I would like to share many things how we can prevent it.
Sure. So let's just talk about, right, the neck is right here and the back is here. So when should we worry about neck and back pain? That's number one. And then how is the correlation between the neck and the back pain? That's what we would like to understand.
See, it's very difficult. I'll make you understand in just 10 to 15, but still I'll try to make you understand in a short span of a time. See, normally nowadays, what we are dealing with, we are using a lot of mobile phones, cell phones, and we use laptops. With that, what we get, we used to start getting hunch at our neck. So this is how our posture is going to do, right? And the people who work on the desktops most of the time, they'll start getting neck pain first, then and then they start developing the back pain. Slowly they are getting like this way. They get strain on the lower back. First they get pain on the neck, then the neck comes forward, then slowly it goes down to lower back, right? So but it doesn't happen, within 2 or 3 months. It takes time to develop these issues. It takes around 5 to 10 years to develop. Some people get within a very short span of a time, like within a year or 2 years, because they use a lot of mobile phone. We even call it a text neck as well, right? So text neck is actually this kind of thing. Normally it should be like, or spine should be like this, but the spine goes, next spine, that's called cervical spine, it goes like this. So that's called a text neck. Nowadays a new term, we call it a text neck, right? Yeah.
Okay. And then, so now that you're saying, then, and it can happen to young people too, because they're the ones who are using more of the text than people like us. So how do we, what are the precautions and what should we do? So, and in earlier time, we would see older people, they are getting the scooped, right? The scooped kind of a thing.
Exactly.
Kind of hunch.
Exactly.
Now this
Exactly.
part, you're saying the text neck is happening. So what are your precautions and what should
See,
we do?
what we have done in the past and present, what we are doing, we are trying to teach our people, our patients, trying to help them out. Work on the proper ergonomics at office. Try to keep your screen around 15 degree of your eyes above, so that it will not see every. If I tell somebody, please try to be straight, so maybe early in the morning, once he start the office, he may go and try to sit straight for an hour. But once he goes into that work, then he start, muscles get fatigued and start. And once he go deep into that work, then he then start getting hunch down. So that is how the problem starts. It's a normal. If I tell, normally, see, we have done small clinical research, and what we found, we used to tell the patient, be straight, do this, but they don't understand it. They keep it in the mind for the first 1 hour, then they forget what we have to do. Right now, what we tell our patients, try to keep your table near your abdominals, like here. If I'll show you properly, near the abdominal area, right here at this area, and so that you lean on that table and try to be straight, and keep your that screen, it should be 15 degree above, so that you will be straight whole day. Use wireless keyboard, use wireless mouse. That will be very helpful. And every 30 to 45 minutes, you should get up from your that desk job, and get up, take 10-15 steps and get back. Because if you're staying more than 8 hours a day, it's a research. If you're staying more than 8 hours a day, that means you're very prone to cardiac arrest, which could be after 40. And if a person smokes around 20 cigarettes a day, is equal to staying 8 hours a day, and you are losing your eyes, you are losing your neck, you are losing your heart, you are putting weight. So there are many complications. If you're sitting whole day, you first, since we are I don't want to divert from your own topic, we are discussing the neck pain. So neck pain starts developing this way. So better to prevent, the first thing what we should do, should, for example, if we are using mobile, we should not work like this. We can keep one hand just below. I'll just show it properly. I'm sorry, my screen is not right way, but we will keep like one hand here, and then other hand we can use it like this way. So this way we can use our other hand so that it will be properly at your eye level. This way we should use mobile, right? And the second thing, we should keep our screen 15 degrees above, right? And that is how we will see whole day on the screen. Third point is we should get up from your chair every 30 to 45 minutes and have a walk of 10-15 get back. Make a habit of getting a water. Don't keep a water bottle at your side. Get up and get some water, so you'll keep having a good, you will be hydrated well as well. And plus you will take some steps as well. And you can do some exercise, like you just try to stretch your pec muscles some, because see, if we are sitting whole day, we get hunch, this shoulder goes forward, rounded forward, right? So this goes like this. So it's better we should do some stretching exercises this way, or we can keep our both hands on the back and try to stretch. And never do like this thing. Simply do this movement, and this movement, and this movement. But don't try to bend forward and go back, because see, our head is around 3 to 5 kg, depends on the body. And there's a very small spine access point on which we do all these movements. If we do it forward, if we do it backward, there may be a chance of disc prolapse. So we should do very simple, gentle exercises, gentle movements at home, like this way, and we can do double chin movements. This will help you to keep us straight. This will help you, because we get normally these muscles, this is called SCM, which gets tight with the time. So we start getting hunch at our sternum area. If I show you clearly, at our sternum area, there's a muscle which gets tight, the fascia gets tight. Pectoralis, the chest muscle, it gets tight, and we lean forward. And then you'll see us at the age of 50, 60, people are like this. That is this is the sign. If you are in 20s, 30s, normally we get a patient nowadays, 20, 25-year-old patient, having very severe neck pain, headache. My people usually call it's a migraine, but they doesn't have a migraine. Mostly people, they have a very strain on the back of the skull, base of the skull. They get a very severe strain because of the tension of the muscles have increased. That is how they get neck pain, they get giddiness. Some people say we cannot get up early morning, we feel giddiness, right? And some people say we feel sometime blackout, right? There are many things. And with that, once we start getting this kind of a posture, ultimately we are putting more pressure on our lower back. See, if our spine is this, to center of gravity will be almost depends our center of gravity. But if this is going forward, center of gravity will change, and ultimately it is affecting our lower back. Our lower back is also forwarding, so we are making it more strain at the lower back, right? Anyways, maybe I may be diverting from topic. Yes, you go on. Yeah, ask me whatever you want to ask. Next question.
Sure. So neck pain we understand, and then the same thing will happen to the back pain, back as well, right? So maybe you can give us some tips as to, you talked about getting up after 30 to 40 minutes. Is there anything that we should make sure for the back pain also? The posture, or if the neck pain translates into the back pain, what other exercises should we do? Like from a physiotherapist point?
There are 2-3 parts. One is the neck, that's called cervical area. Then we have a middle part, thoracic area, and the lower back, lumbar area. So if we consider for the neck exercise are a bit different, then we have to, if we are talking from from cervical thoracic area, that is called a postural area, where we start bending kyphotic posture. We actually teach our patients at our clinic normal days, go for posture correction. Don't get those belts which you see on online nowadays. Normally people ask, shall we use those belts? I told them, if you using these belts, then we will get more work from you, then we will get more patients. That is not the, you know we are, that means we are losing our muscles are not working. We are dependent on that belt. Unless you are using that belt, you must be very good. Once you are removing that belt, you feel low, you feel down. That means you are dependent on that belt. Rather than using that belt, we should strengthen your muscle. We should see, this is our neck. I must just give me a sec. I just make a, I'll open tab. I'll show you something that will help us properly. Okay, just a sec. Okay, okay. Maybe you can see it from here, but
Mhm.
I
Oh,
don't
yes,
think it's, I don't think it is
yes.
visible. I don't think,
It's
is it visible?
it's hang on one second.
No, no.
Little bit. Yeah, now I can see it. We can see it.
See,
Yes.
yeah, you can
Yes.
see this one. This is a good, it should be, the posture should be like this. This is called thoracic region, this is called neck region, and this is called the lumbar region, right?
Right. Yes.
Especially for the female patients, they get this hump here, because
Hmm.
there are two things. One is female patients have a sagging effect of the breast. That's why their shoulders go rounded forward. I normally advise to my patients, use sports bra rather than normal bra. They should use sports bra, right? One thing is this. Second thing is, do a lot of exercise for the upper back. Like in gym, I'll tell you some things. Maybe the who must be watching these, they will understand it better way, or they can note it down. Few things like, they must do rowing exercises at gym. Rowing is a very good exercise. Just you have to keep your hands like this, and then give a traction to that cable. That's called rowing exercise. One is flies in bench press. One is decline press. One is plover. One is reverse butterfly. One is pull down. These things they should do. And one more thing, at office, we everybody finds a corner somewhere at office. At least do 10 to 15 repetitions of push-ups on while standing nearby corner. It should not be on the, it should not be on the one surface. It should be on the two surfaces, like this way, one hand on the one surface and the one. So that will be helpful. So we will get stretch at these points. We'll get stretch at these points. The shoulder will be like this. If we keep it stretch all the time, then it is easy to strengthening as well. We cannot do only strengthening. Strengthening will not help you. We need to stretch the front posture as well, like chest muscles, right? This way, you need to stretch it. Sometime at work, you should do it regularly. Like these exercises, we should do. And one more thing, some people use collar. They use collar. They feel pain. They use collar, which is not good idea. Collar we should use once somebody is feeling giddiness or something like that, or vomiting. That is the only when we should use collar. Some people feel pain, they use collar, which is not a good idea. Avoid that. Avoid that. Right? Yes, but if you are having the issue with that, like vomiting, or that you have a giddiness, you should consult your physician as soon as possible. You should not go out without the collar, right? And one more thing, I must add you that exercise is very important. You should do it. At least it will take hardly 10 to 15 minutes. Even you can do it at office. These are very some simple stretch. You can do some stretch like this. If I can show you properly, just give me a sec. You can do this way you can do, or you can keep your hands like this way, try to stretch your chest muscle, right? And you can get we have a, nowadays we can get a band that's called resistance tube. Resistance tube are very simple. You have medium level, low level, high level, medium, those bands, resistance tubes. You can get that band. With that, you can do some stretching with that. Just stretch that band, you will feel that strengthening on your upper back side. All right.
All right. Well, thank you so much. These are quick sessions, 10 to 15-minute sessions that we bring on a daily basis. Any questions you have, Rosalind? You're welcome to unmute yourself or put it in the chat window for Dr. Ahmad. Any comments, any feedback? Like I said, this is a quick 10 to 15-minute sessions that we do on a daily basis. And we are coming up with workshops on a monthly basis. And also we are going to make all these interviews available free of cost to everyone. We're launching in December. But any comments from you? All right, I think there's a message here. Let me see. Thank you, no questions. All right, thank you so much, Dr. Ahmad, for being with us, for educating us.
See, I really apologize. I couldn't make it properly because the setup was not, because we have a time difference. Since you are staying LA, I'm staying in India, so we have a time difference. That's why I cannot make it more a proper setup. Because I'm sitting at home, it's almost 10:30. I was supposed to sleep now. Anyways, thanks for having me on your show. Thank you, really appreciate it.
Thank you so much for all this knowledge as well. Thank you.
Thank you.